everyone, and welcome to our live lesson for today. My name is Bethan Edwards and I am the Academic Director here at Specialist Language Courses. And today we are going to be talking about OET Listening C, and we're going to be talking today about some of the skills that you need to develop in order to help you be successful in your OET Listening C paper. Did you know that we are now doing 4 live lessons a week? So if you would like to come along to our 4 live lessons a week, then please sign up to our Reach OETB course, which is a great course that gives you plenty of practice and preparation ready for your OET exam. And our next free live lesson is going to be next week, which is going to be on Wednesday. And that will be with Joe, and it will be on Reading A. And you'll be looking at Reading A practice. You can find the link in the chat box to sign up now. So please don't forget to sign up for our next free live lesson. All right, so we're going to look today at vocabulary for expressing opinions and what you can expect in OET Listening C. We are going to look at the different ways that opinion and attitude can be expressed in Listening C, and then we're going to do some practice together, focusing on how to understand and listen for opinions, and then we are going to look at some study tips. So what can you do in your practice when you're getting ready to take your OET? What can you do to help you improve your skills and understanding of opinions and attitudes in Listening C? All right, so let's come to you. So my question for you is, what words, phrases, expressions do you already know for giving opinions? Or what phrases or expressions have you heard when you're doing OET Listening C practice? So write your ideas in the chat box now. Let's share all of your ideas here. So we're looking specifically for what people say when they're going to give an opinion. For example, in my opinion is one example. Excellent. Okay, great. So we've got in my opinion, I think. Interesting. We've got some idiomatic expressions coming in here. So we've got a great idiomatic expression. Those are my 5 cents. So that's great. That's a way to give an opinion, particularly in listening. Excellent. We've got some interesting, we've got some hedging language as well. We've got may or suppose as well. Okay, great. So we've got quite a variety of phrases here. All right, so let's take a look at some of the ways that writers can give opinions. Now, something to notice is you've in OET, you need to look for opinions and attitudes in reading and also in Listening C, but the phrases may be different. So we're thinking particularly about how people could give their opinions in a presentation or in an interview. So first of all, as you've identified, you may have some verbs. For example, we have the ones that you've thought of: I think, I believe. We've also got I feel as well. And then we've got some hedging phrases, like you've mentioned, for example, may or suppose. And we've also got it seems to me that. Now, these verbs do come up in OET Listening C, but you also need to be aware of phrases. For example, I'm optimistic that, or the opposite, I'm pessimistic that. So here we've got some clear verbs to give opinions, but as those of you who've got OET Listening C experience, it's not always quite so clear as these verbs. So we've got these other phrases as well. So I'm against, he's convinced, she's satisfied, I'm on the fence, and it's reasonable to say. Now, I'm on the fence is another interesting idiomatic expression, for example, similar to those are my 5 cents. I'm on the fence, meaning that the speaker isn't really decided. They're not really sure if they agree or if they disagree. So they're on the fence. So you have phrases. You also need to be careful to look out for signposting words and phrases. These are really important in listening C, as they may change the direction of the speaker's opinion. So, for example, you may have a speaker presenting some evidence or talking about a study. So they might say, for example, many scientists claim that, however, it's my belief. So be really careful when you're listening out for those signposting words to see what the speaker's opinion is and how does it change or how does it compare to other people they might be quoting. You also have adjectives and adverbs that can show you a speaker's opinion. For example, we have surprisingly or unsurprisingly, fortunately or unfortunately, or obviously as well. So watch out for those adjectives or adverbs that can also show you an opinion. So in your OET listening, for those of you with experience in listening C, you will know that often speakers will talk about perhaps research that has taken place or studies that have taken place, and they will give their opinion and they will discuss these studies. So it's really important that you're familiar with phrases that are commonly used to talk about facts and phrases that are used to express opinions. As you will have both of these in listening C presentations and interviews. So we are going to look at 5 sentences, and for each sentence, so 1 to 5, I'd like you to decide, is it expressing a fact or is it expressing an opinion? And we're going to do this as a poll. So I'm going to show you the sentences on the screen, and I'd like you to take a few moments to read through them, and then I will launch the poll. All right, so I'm going to launch the poll now. It should appear on your screen. For each question, I'd like you to decide, is it fact or is it opinion? So let's launch that poll now. All right, so that should be on your screen. So start voting now. Fact or opinion? What do you think? All right, so I'm going to close the poll now, and let's take a look at your results. So there is some, particularly around question 2, there is quite a consensus. Question 3, 78% of you believe it's a fact. And then for the other questions, you're a bit more divided. So let's take a look at the answers and let's take a look at why. So question number 1. In his report, Dr. Smith suggested that the results of the study were inaccurate. So this is our key verb here. Suggested is to give an opinion. He's not quoting a fact. He is giving his opinion that the results of the study were inaccurate. It's not a fact verb, so it's not telling us that they were inaccurate. It's giving us Dr. Smith's opinion on the results. Number 2, the majority of you got this one right. So I feel that the current program could be improved. So this is an opinion. We're using an opinion verb here. So number 3, I can tell you that the results revealed that 50% of the participants said yes. Now, our key verb here is revealed, and this is for a fact. So when you are listening to people discuss results or studies, you've got some key verbs like revealed, showed, etc. So this is expressing a fact. Number 4, what we can see here is that the nurse who undertook the research, so here we do have a fact, she undertook the research, it happened, this is a verb that we're using to talk about something that happened, but then we carry on reading, the nurse who undertook the research suspected that there was an error. So here she suspected, she doesn't have proof, it's her opinion, it's what she thinks. Number 5, now number 5 is interesting. Number 5, we have more testing should have been done. So this is a passive structure, and it's also using a modal verb to express opinion. So it's slightly different to the other verbs that we have. It's a modal verb. So our modal verb is an opinion. Excuse me. Something that did not happen, but in the speaker's opinion, it would have been a good idea. So this is also an opinion. So in listening C, you need to recognize opinions and attitudes in the question, in the options A to C, and also in the audio. So let's take a look at some opinions in questions. So look at questions 1 to 3 and identify the words which show opinion. And I'd like you to write your ideas into the chat box, please. So no, you can write number 1, 2, and 3, and then you can click 1, 2, and 3, and you can also write what words you think. Great. All right. So you've all got the right ideas. So for number 1, Dr. Robson thinks. Number 2, Sandra believes. And number 3, Dr. Sands feels. Great. So you need to watch out for those opinion verbs in the questions. So let's do some practice, and we're going to really focus on how you can listen for opinions. All right. So we have a question. So our question is, Dr. Robson thinks the short-term priority in the fight against Chagas is to, we're not looking at the options, we're just going to listen quite carefully for the vocabulary relating to opinions. So what I'd like you to do, we're going to listen, I'd like you to listen and make a note in your notebook, which phrases does Dr. Robson use to give his opinion on this topic, the short-term priority in the fight against Chagas. All right, so listen, we're not looking for the answer, we're just listening for those opinion phrases. All right, so let's listen and make a note. Which ones does he use?
And what can be done to combat Chagas generally?
Plenty. Researchers are working on improved drugs to treat it and a vaccine. None currently exists, but it takes at least 10 years to supply a new drug. Another idea is to develop the existing drugs in tablets of different sizes. That could and should be done almost overnight. What's currently available is designed for adults, even though infants often have the disease. There are also some very important programs using insecticides and other methods to wipe out the bugs that transfer Chagas to humans, but initiatives like those take decades rather than years.
Well, Dr. Jack Robson, thank you very much for speaking to us today.
All right, so which phrase did you hear? Did you hear, in my opinion, this must be done immediately, that should be done, or I think the most important thing is, what did you hear? Great, good. So, yes. So we heard this phrase. He said that can and should be done overnight. So we don't have such a straightforward verb as I think or I believe or I feel, but we've got a modal verb to express his opinion here. All right, so let's take a look at this question. So we're going to look at the different options and we're going to listen for the answer, taking particular notice of this phrase, that can and should be done. We want to know, what is that referring to? So a couple of things to notice. In the question, he particularly talks about short-term priority. So we've got short-term priority here, we've got some ideas, but then we've got our word here, overnight. So we know that this is a short-term priority. So is it the short-term priority A, to eliminate the insects? Is it B, to produce medication suitable for children? Or is it C, to design and manufacture a viable vaccine? All right, so we're going to listen again. Some of you may remember the answer from before, but we're going to listen again and notice particularly, what does this refer to? That should be done.
And what can be done to combat Chagas generally?
Plenty. Researchers are working on improved drugs to treat it and a vaccine. None currently exists, but it takes at least 10 years to supply a new drug. Another idea is to develop the existing drugs in tablets of different sizes. That could and should be done almost overnight. What's currently available is designed for adults, even though infants often have the disease. There are also some very important programs using insecticides and other methods to wipe out the bugs that transfer Chagas to humans, but initiatives like those take decades rather than years.
Well, Dr. Jack Robson, thank you very much for speaking to us today.
All right, so for those of you who haven't, put your answers in the chat box. Excellent. I can see everybody is in agreement today with this one. So we have got, our answer is B. So we've got that can and should be done almost overnight. So we've got both the information before and after our opinion phrase. So developing existing drugs in tablets of different sizes, designed for adults, even though infants also have the disease. All right, notice why the other ones are not correct, because we have got, it takes 10 years to supply a new drug, so viable vaccine. And then we have also got the A, takes decades rather than years. So that doesn't address the short-term aspect. All right, let's take a look at another piece of audio. So this time we're going to listen to a woman called Sandra talk about her work in a community follow-up clinics for prostate cancer patients. I would like you to listen and write down the phrases that Sandra uses to show her opinion when she's talking about these three topics: the importance of community follow-up clinics, staff opinions on community follow-up clinics instead of large hospitals clinics, and the future of community follow-up clinics. So you don't need to answer any particular question here. Just write down the phrases that she uses to offer her opinion. Could be a verb, could be a linking phrase, or it could be an idiomatic expression. All right, so write these down in your notebook.
For me, these factors really underline the importance of the community follow-up clinics we have in my area, which address many of these issues in the provision of healthcare for cancer patients. Staff at these clinics see patients during their recovery and only send them back to hospital for treatment if they develop significant new symptoms. Seeing patients in the clinics means that staff get to know each patient and build a relationship with them, which enables nurses like me to dispense advice and answer questions. And although we have no firm evidence, staff feel that's far more beneficial to patients than attending a large hospital clinic. So we're hoping more clinics like these can become available.
All right, so let's take a look and compare your answers to what she used. So on the importance of community follow-up clinics, she used the phrase "for me." So for me is an alternative to "in my opinion." Excellent. So for me, and then that is your indicator that she's going to give her opinion. The second one, we have staff feel. that it's more beneficial. So we have a main verb, and then we have also a comparative here that's also supporting and giving more information on the staff's opinion. The future of community follow-ups, we've got we're hoping. So it's not a fact, it is something they would like, therefore it's giving their opinion. All right, so let's take a look at that in the context of an OET practice question. So our question is, Sandra believes that community follow-up clinics are important because. So notice we've got these opinion words in the question. So we know that we're listening out for Sandra's belief and Sandra's opinion. Is it A, are they community follow-up clinics important because they offer patients more personal aftercare? Notice, think about what is included in personal aftercare. She may not say personal aftercare, but what does that include? Is it B, are the community clinics, follow-up clinics important because they are proven to be less traumatic? Remember the words that we saw before about fact versus opinion. So you might hear some words relating to evidence or study or one of those key verbs there, reveal, show, or indicate. Or is it C, they provide rapid treatment for patients developing new symptoms. So the question to ask yourself here is, are the new symptoms treated in the community follow-up clinic or not? All right, so let's listen again, and I'd like you to listen and make a note of what you think the answer is, A, B, or C. Let's listen.
For me, these factors really underline the importance of the community follow-up clinics we have in my area, which address many of these issues in the provision of healthcare for cancer patients. Staff at these clinics see patients during their recovery and only send them back to hospital for treatment if they develop significant new symptoms. Seeing patients in the clinics means that staff get to know each patient and build a relationship with them, which enables nurses like me to dispense advice and answer questions. And although we have no firm evidence, staff feel that's far more beneficial to patients than attending a large hospital clinic. So we're hoping more clinics like these can become available.
All right, so pop your answers in the chat box. Why does she believe they are important? Excellent. Okay, great. Well done, everybody. You are all right. So, A, Sandra believes that community follow-up clinics are more important because they offer patients more personal aftercare. So here we've got her opinion for me, and they underline the importance. Then we've got examples of what this personal aftercare is. Staff get to know each patient, and this allows nurses to dispense advice and questions. So it's more personal aftercare. So when you're checking your answers, it's always a good idea to make sure that you look at why the other answers are not correct. So for B, we wanted some evidence here. And here, notice we've got this linking phrase, although. So we've got although that introduces a contrast, but she says, although we have no firm evidence, so it's not proven. And then we look at C, and C, our question was, are the new symptoms treated in community follow-up clinics? And our answer here is no, they are sent back to hospital if they develop new symptoms. All right, so it is really important for you to really prepare to listen for opinions in part C. So some things that you can do to help you prepare is listen extensively to presentations and podcasts such as TED Med or BBC Inside Health. Choose audio that includes opinions on research. And when you're selecting what to listen to, make sure you're choosing something where perhaps they comment on research. Listen to a variety of audios. Listen out for the speaker's attitude and opinion, and make notes on these phrases. So our top tips: make sure you listen to audio with opinions, make a note on any phrases for given opinions, and as we've done today, use the transcripts to help you identify those attitude and opinion phrases that will help you in listening C. All right, so we have a few moments for questions. So if you have some questions, please pop them into the question and answer tab, and we will do our best to answer them today. All right. Okay. So any questions, pop them into the chat box and we will do our best to answer them. All right, so we have a question about Listening Part C resources. So Listening Part C resources, you have the practice papers that you can use, and use those study tips that we've recommended. Make sure you use a transcript. Make sure you're looking out for attitude and opinion. Other resources, you should really listen extensively, as extensively as you can. So listen to talks on TEDMed, choose medical topics, and make sure you're listening out for those opinions. All right, and okay, thank you very much, everyone, for coming along today. Please don't forget to sign up for our next live lesson. So our next live lesson is going to be on reading A, and that's going to be with Joe. So you can find the link and sign up to the next session now. So it's on Wednesday, the 15th of December. Tune in to our social media platforms and follow us for more information. We're doing live lessons every week, so please come along and follow us on our social media platforms. The links will be available for you in the chat. And if you are getting ready for your OET, we have some great courses that can support you. So we have Reach OET Nursing and Medicine. So this is a self-study course that you can use to help develop your skills, to develop your vocabulary, and help you to understand more about the test. We also have OET Writing Correction Service if you want some help with your writing in particular. And we also have the OET practice test, which was a great resource for you to help practice your timing. Thank you very much, everybody. Bye-bye.